Hello, this is Dr. Noel Fernandes. Today we are going to talk about the coronavirus and how it is affecting, how we need to prevent ourselves, how we can protect ourselves and stop its spread in the community. What is the coronavirus? Coronavirus are a large family of viruses that cause illness to humans as well as animals. In humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe disease such as the Middle East respiratory syndrome and severe acute respiratory syndrome. This current COVID-19, the outbreak began in December 2019 in Wuhan in China. What are the symptoms of COVID-19? The most common symptoms are fever, throat pain and dry cough. The other symptoms could be body ache, nasal congestion, running nose, sore throat, diarrhea and abdominal pain. In many patients, the symptoms are not demonstrated or they will take time before the patient complains of these symptoms. How does COVID-19 spread? COVID-19 spreads because of droplet infection. When a patient coughs or sneezes, these droplets could fall on objects and another person who touches these objects and then touches their nose, mouth can get affected. Can the virus that caused COVID-19 be transmitted through the air? Studies to date suggest that the virus that causes COVID-19 is mainly transmitted through contact with respiratory droplets rather than through air. Can COVID-19 be caught from a person who has no symptoms? The main way the disease spreads is through respiratory droplets expelled from someone who is coughing. The risk of catching COVID-19 from someone with no symptoms is very low. However, people should take precautions of maintaining at least a distance of 1 meter from any person who demonstrates the symptoms of COVID-19. Can I catch COVID-19 from the feces of someone with the disease? The risk of catching COVID-19 from the feces of an infected person appears to be low. While initial investigations suggest the virus may be present in feces in some cases, spread through this route is not a main feature of the outbreak. What can I do to protect myself and prevent the spread of disease? Regular and thorough cleaning your hands with an alcohol-based hand rub or wash them with soap and water. Maintain at least 1 meter distance between yourself and someone who is coughing or sneezing. Avoid touching eyes, nose and mouth. Make sure you and the people around you follow basic good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Stay home if you feel unwell. Keep updated on the latest COVID-19 hotspots so that you avoid going to such places where the infection is spreading rapidly. Follow the advice of good hygiene. Self-isolate by staying at home if you feel unwell. If you develop fever or cough and having difficulty in breathing, seek medical advice. For most people in most locations, the risk of catching COVID-19 is still low. However, there are some places around the world where the disease is spreading. COVID-19 outbreaks can be contained and transmission stopped, as has been shown in China and some other countries. Unfortunately, new outbreaks can emerge rapidly. Should I worry about COVID-19? Illness due to COVID-19 infection is generally mild, especially for children and young adults. However, it may cause serious illness in about 1 in every 5 people who catch it and who will need hospital care. It is therefore quite normal for people to worry about the COVID-19 outbreak and how it will affect them and their loved ones. We will channel our concerns into action to protect ourselves and our loved ones and our community. Who is at risk of developing severe illness? While we are still learning about how COVID-19 affects people, older persons and people with pre-existing medical conditions such as high blood pressure, heart disease, lung disease and cancer or diabetes appear to develop serious illness more often than others. Are antibiotics effective in preventing and treating COVID-19? The answer is no. COVID-19 is a virus and antibiotics do not work against viruses. Are there any medicines or therapies that can prevent or cure COVID-19? While some Western traditional or home remedies can provide some comfort and alleviate symptoms of COVID-19, there is no evidence that the current medicines can prevent or cure the disease. Is there a vaccine, drug or treatment for COVID-19? Not yet. To date, there is no vaccine, no special antiviral medicine to prevent or treat COVID-19. Possible vaccines and some drug treatments are under investigation. The most effective way to protect yourself and others against COVID-19 are to frequently clean your hands, cover your mouth while you're coughing with a belt, elbow or a tissue, and maintain a distance of at least 1 meter, which is 3 feet, from a person who is coughing or sneezing. Is COVID-19 the same as SARS? The answer is no. Both are different viruses. SARS was more deadlier but much less infectious than COVID-19. Should I wear a mask to protect myself? Only wear a mask if you're ill with COVID-19 symptoms or looking after someone who has COVID-19. WHO advises rational use of medical masks to avoid unnecessary wastage of precious resources and misuse of masks. When to wear a mask? If you are healthy, you only need to wear a mask if you are taking care of a person who is infected with COVID-19. Wear a mask if you yourself are coughing or sneezing. How to wear a mask? Before putting on a mask, clean your hands with an alcohol-based hand rub or soap and water. Cover your mouth and nose with the mask and make sure that there are no gaps between your face and the mask. Avoid touching the mask while using it. Replace the mask with a new one as soon as it becomes damp, and all these are usually single-use masks. The next slide shows you how to put on, use and dispose of a mask. How long is the incubation period for COVID-19? The incubation period means the time between catching the virus and beginning of new symptoms of the disease. Most estimates that the incubation period for COVID-19 ranges from 1 to 14 days. Can humans become infected with COVID-19 from an animal source? Coronavirus are a large family of viruses that are common in animals. However, the documentation of people getting infected from animals has not yet been noticed. Can I catch COVID-19 from my pet? We are aware of instances of animals and pets of COVID-19 patients being infected with the disease. However, it's still too early to say whether this disease can be transmitted from your pet to yourself. Is it safe to receive a package from any area where COVID-19 has been reported? Yes, the likelihood of an infected person contaminating commercial goods is very low, and the risk of catching the virus that causes COVID-19 from a package that has been moved, traveled or exposed to different conditions and temperature is also very low. Is there anything that I should not do? The following measures are not effective against COVID-19 and can be harmful, such as smoking, wearing multiple masks and taking antibiotics. Is the source of coronavirus causing COVID-19 known? The answer is that the source is still unknown. All available evidence suggests that it has a natural or animal origin and is not a constructed virus. How did the first human corona infection occur? The first human case of corona-19 was identified in Wuhan City, China in December 2019. At this stage, it was not possible to determine precisely how humans in China were initially infected with COVID-19. Is COVID-19 airborne? The virus that causes COVID-19 is mainly transmitted through droplets generated from an infected person who coughs, sneezes or speaks. These droplets are too heavy to hang in the air. They quickly fall on floors or surfaces. You can be infected by breathing the virus if you are within 1 meter of a person who has COVID-19 or by touching a contaminated surface and then touching your eyes, nose or mouth before washing your hands. Thank you.